Thank you so much for joining in. I just wanted to talk about what mental health has been like. Your idea of what mental health has been like, both before and during this pandemic. We've got Francine and Olivia, Liz and Jason. For me personally, mental health services were pretty dire before all this. I've had at least 2 incidents where I could have really done with support. Really done with some major support. So now this was probably about April, May, June. Francine, I could see you just kept nodding along there.
Yeah.
And I know you've got tons of insight.
So this to me is like my way. I have OCD, so this whole pandemic is like the worst nightmare possible for me. I also am disabled and suffer with chronic pain. So the only help that I've had during lockdown, so since March, is some diazepam.
That's it.
They've just thrown diazepam at me.
Have you noticed a lot of differences between before, say let's say January and now?
I was getting my support from the pain management team. I wasn't getting any support specifically for my OCD because my CBT the year before didn't work out.
Right.
They just said you'll have to do it privately because I needed more of a counselling than a CBT, and you can't get that through the NHS because of them Tories.
Yeah, you're amongst friends here, so don't worry, that's absolutely fine. Has anyone been working from home at the moment?
Yeah, I've not minded it too much because being a bit of an quite a bit of an introvert, like it for me, it's I quite like having that barrier. So I don't have my commute anymore, which means I don't have the stress of being around other people. So particularly as we were getting closer to the whole like working from home thing, I was getting quite stressed about using public transport. So I was getting quite stressed about that. And so I think for me, working from home has probably been quite positive. It has been when I actually changed jobs 6 weeks ago to a completely new company. Changing roles during lockdown was interesting because I've had to meet like an entire new company of people. I had a meeting today and they were like, so you just met everybody just over Teams? And I was like, yeah, pretty much. And they were like, that's so strange.
Wow.
I was like, yeah.
Wow.
You won't know what everyone smells like.
That I'm kind of I found most people are a bit more like relaxed in what they're wearing and stuff. Like you're not in suits and stuffy work clothes. So people generally are a little bit more relaxed.
Do you think? Can you just tell everyone where your office is?
All right. I don't know how to reverse this, but basically, the bed's there, and then my office is there. It's like a foot from my bed.
Yeah.
So I got into a very unhealthy habit of waking up like 2 minutes before work and just logging on.
I think that's a huge thing at the moment. I mean, we weren't allowed to leave the house anyway for such a long time. It's no surprise that everyone is now getting really depressed.
I've found that sorry, like those people talking. I found that I've been like going out and exploring different areas that I literally have never been to, that are literally like right on my doorstep.
I'm disabled, so a lot of places aren't accessible. So the only places I could go are like the major parks, like Roundhay. Police were there stopping people going, and part of my OCD is that I'm actually quite scared of the police. I went to the woods, which has got a bit of a path through it, and I have to use a mobility scooter, and I'd just be getting stuck in the mud and things. I can't really go around where we live because everyone knows us because we're weirdos, and they weren't respecting our like distance.
Yeah. What is it with like, so in the supermarkets for me, like, I don't know what everyone else's local supermarkets were like, but they had all those directional arrows on the floor for like a little bit.
Oh my God, people don't know how arrows work.
You're like trying to pick your cheese or something, and literally there's a person stood right next to you, and you're like, hello? This is, oh God. Yeah.
I just get more wound up about it, like when I see people and they're wearing their mask and they're not wearing it over their nose, and I'm like...
I found though in the past people just didn't respect our distance at all. There was a woman sat outside Couplands. I think she was a bit annoyed because she wasn't allowed in for a sausage roll because she didn't have a mask on. Anyway, I got out of the car, put my mask on, and she went, "You're the problem." And I'm like, on a small road.
Where are they getting their information? You know, it's
Yeah.
They just need to shut down Facebook for like a week or something. I feel like it's sometimes it gets like a bad rap sometimes. Calls and stuff like this are obviously good parts of it. And then you get the bad parts. For me, like news and like news on social media.
Yeah.
Throughout this whole pandemic thing, it's just been absolutely wild. And there have been some days where I've just been like, I'm just completely like turning off my phone.
Yeah, everyone seems to be just utterly confused. But what is really nice about this is that we've all experienced the same things and got annoyed at the same things, so we're not that odd. Do you know what I mean? All right, okay, I'm not that weird. Jason, you were hospitalised in February with the flu. Like, you were never tested for coronavirus or anything like that. But like, how bad was that experience when you had to go to hospital with flu?
Just a really bad flu, to be honest. Yeah, I was just going to crack on, but our Sam wasn't keen on me, so she made me ring 111 and that were it.
Is people are saying, oh, it's just a flu, and as we've just talked about with Jason, like, proper flu will make you very poorly.
Yeah.
Like, I had proper flu a few years ago. I was still ill like months later. I was still really lethargic. It took me months probably to recover from proper flu, and it's like, flu isn't just a it's not cold. It's not, you're not recovered in a week and you're back at work and it's all fine. Proper flu will genuinely mess with you for a long time. And if I get that badly messed up by a proper flu, how badly is my nan going to get messed up by a proper flu?
Yeah, being able to leave the house again and being around people was so intense. I had to go back to work in a shop, and I was having panic attacks all morning. Olivia, like, have you been back to work or you?
So I work in advertising, or did work in advertising. I was on furlough for, I think it was almost 5 months. That was the longest period in my life that I haven't worked.
Yeah.
It was horrible.
Yeah.
And then I went back for a few weeks, and then 3 weeks ago I was made redundant, so I'm sort of back in the same position now.
Oh man, what's that been like to your mental health?
Just appalling. Yeah. It's definitely like, I feel like I've sort of been put back a few years.
Sure.
I don't know, it's been a weird sort of time of kind of reassessing everything, and just a lot of thinking like, do I want to do the same career? Like, what the hell am I going to do?
Good effort for going, right, I'm going to reassess.
Yeah, there's been wallowing, definitely. Forked out very reluctantly for some private help, but
that's really good that you've actually recognised and go, nah, I can't hold on, I can't wait, I need to do this. But the other side of that, it's sad that you've been forced that you've got to put your hand in your own pocket, and I don't even think it's a case of being able to afford it. It's a case of no choice, isn't it, really?
I think that, like, I found that's been the case for quite a while. So when I went through my stuff about 4 years ago, it was kind of a case of, well, when I spoke to my GP, they were like, well, you can go, we can do it through the NHS and stuff, but we can't guarantee how long it's going to take you to get, even on the list and, even close to a point where you can get some help. Or you could just go private. And it was like, well, that was that. And it was just that sort of like flippancy of like, well, you can go pay for it yourself if you really, and it's like, well, that's not, it didn't feel like a particularly like constructive, helpful thing to be like, oh, you should just go pay for it yourself. And it's like, yeah, just because I could have afforded it, like, what happens if you're in a position where you can't afford it and you are at that point where luckily for me at the time, I had a really, really good employee assistance program at work where I had a helpline I could ring, and they were sort of getting me through like the worst of it whilst I was waiting for like my CBT and things. But if I hadn't have had that support, I probably would have had to go privately, because I wouldn't have been able to last as long as I did on waiting for the support from the NHS. And if you're not in a position where you've got that thing through work, or you can't pay for it privately and you are just stuck on a waiting list, what do you do? And it's that kind of like muddling through constantly that is so bad. Like, what are people meant to do? There's only so long you can muddle along for.
I used to be a primary school teacher. Then I became disabled, and now I have my partner as my full-time carer. So we don't have much money. When I've been to the doctor, they've said, you know, you're on the waiting list. You get to the top of the waiting list, you get what you're given. But the thing is about therapy, it's a relationship almost.
Yeah, it is.
When I was trying to get some of my medication, so it ran out, and they were saying that everyone's on it now.
It's like doctors had their hands tied behind their backs anyway, like before all this. I speak to my care coordinator, and he goes, I wish I could help you. I wish I could do this. I wish I could put this in place, that in place. But all I can do is actually ask you what you want me to do for you. That is all I can do, and offer limited guidance and things like that. So I don't think, it's really horrible, because the people that are working for the NHS and their mental health services are as desperate as we are by the sounds of it. And I think that's why the suicides this year have definitely gone up. I mean, they've doubled for men in the last 6 months or something. But thank you all so much. Yay! There's a cat. We need cats to finish off with, don't we?
I was going to bring mine up, but she's sleeping. So
mine's asleep downstairs, and she's quiet for the first time all day. So we're just going to leave her.
Let her sleep. Right, brilliant. Right then, guys, I will see you all very, very soon, and thank you so much, and stay safe and take care. Okay. Bye. Bye. Like Family Fortune.
Did you like talking to all your friends, Papa? Thank you everyone that's just taken part in that group call. I'm absolutely blown away by people's honesty and being able to share with each other, and I really appreciate that. If you would like to get involved in our next call, just send us a message at Pixie the Adventure Puss on Instagram and Facebook. Hopefully this has shown that we aren't that weird, we're not that alone, we're not that different. If you wouldn't mind sharing this video with others that you think might appreciate it or enjoy it, that would be really great. Thank you, and take care of yourselves, and we will see you all again very soon.